Hi, Dr. Yass here. In this video, I want to reaffirm the fact that I have established over almost 3 decades and thousands of patients that in more than 98% of cases of pain, the cause is muscular, meaning that weakness or muscle imbalance is the reason for the pain. And unless you address the muscular deficit, you will never resolve the cause of the pain, thereby ending the need of the muscular deficit to elicit the pain. Now, this includes almost every case where somebody had a positive finding on an MRI or X-ray, such as a herniated disc, arthritis, stenosis, a pinched nerve, meniscal tear, labral tear, compression fracture. All of these were identified, and the person came to me based on that diagnosis, but I was able to prove that those were independent variables, meaning they existed. No one's denying they existed, but had nothing to do with the tissue in distress eliciting the pain, which again, I have concluded in more than 98% of cases is muscular. Now, when I say muscular, people say, oh, he's talking about when my quad strains or, my lower back muscle. I know it's the muscle, but that doesn't really relate to me. Well, there are 4 primary mechanisms that allow muscle to elicit pain, and many do include referred symptoms that are often perceived to only come from nerves, as well as where you have a neurological symptom, but the neurological symptom is not from a pathology of the nerve, but a muscle straining and impinging on the nerve. So I wanted to very briefly go through these 4 mechanisms. One is the more common one. Say, for instance, you have pain at the upper trap region, and the muscle, the levator scapular, is eliciting your pain. Most people don't understand that that is actually unrelated to the cervical spine. Levator scapula, elevate the shoulder blade. The upper trap region actually associates to shoulder function, and therefore, in trying to utilize your shoulder, other muscles that relate to that evolve around the shoulder or shoulder blade have strain, causing the levator scapula to overwork. Therefore, it strains and elicits pain. So you have muscle straining, causing other muscles to compensate. Eventually, the compensating muscle strains and elicits pain. That's number 1. Number 2, one of the bigger ones that we talk about relating to joints is the fact that joint pain does not relate to, in most cases, the structure of the joint, but muscle weakness or imbalance causing a misalignment of the joint surfaces that make up the joint, and they end up tracking inappropriately, causing them to rub and elicit pain. The great example of that is pain around the kneecap, and that is a case where the kneecap is attached to the front thigh via a tendon. And if the front thigh muscle, the quadricep, ends up being stronger than the hamstring, it can cause it to shorten, which causes an excessive upward pull on the kneecap, so that when the knee is bent, instead of the kneecap simply gliding through the joint, it is compressed through the joint. That is why you get pain when you bend, twist, kneel, go upstairs, walk for a sustained period of time, sit for a while. So although your pain is at the joint between the kneecap and the thigh bone, the reality is that the cause of that pain is excessive compression of the kneecap due to a quadricep muscle, front thigh muscle, that in effect is stronger than the hamstring and therefore shortened, creating an excessive upward force on the kneecap. There are other muscular causes, but that's one of the more primary ones. So you could have pain at a joint and it is still caused by muscle weakness or imbalance. Number 3 is that muscles actually do refer symptoms. We know that because one of the indications of a heart attack or pain at the chest and the left arm, that is a referred symptom from the heart. And in fact, the heart is a muscle. So the common one that represents this is the person who's laying on their shoulder, and as they're laying there, their hand goes numb, and then they stand up, then the numbness goes away. That is not related to the cervical spine. You know that because if in fact you stood up, there's an increased gravitational force on the spine. Therefore, you would expect your symptom to increase. The numbness should increase when you stand if it was coming from the cervical spine. It is actually referred from a muscle that runs around the shoulder called one of the shoulder rotator cuff muscles called the infraspinatus. And as your shoulder rolls forward, when it's weak, it actually causes the rotator cuff or infraspinatus aspect to become overstretched, thereby straining, thereby referring symptoms down to the hand. You could see this quite simply if you just looked up trigger point chart for infraspinatus. You will see that when that muscle strains, it can refer symptoms down to the hand. So that's number 3. Number 4 is a muscle constraint and impinge on a nerve. So as far as I'm concerned, the phrase neuropathy is a ridiculous statement. It is based on the idea that the person giving it cannot give you the understanding as to what tissue is creating the symptom. Since they're neurologists, they have to give you a neurological diagnosis. So they simply say the word neuropathy. I have found in the greater cases where things such as sciatica existed, the reason for it is a muscle called the piriformis muscle in the gluteal region strains due to another muscle that sits on the side of the pelvis responsible for balance and stability, straining first, causing the piriformis to compensate. As it strains, it thickens and impinges on the sciatic nerve, thereby giving you sciatica. So you have a muscular cause creating a neurological symptom. So under the Yass method of understanding, those are the 4 primary mechanisms by which muscle can create symptom over almost 30 years and thousands of patients. I have proven that, in fact, in more than 98% of cases, one of those 4 were responsible for the symptoms. The great news is that with a couple of treatments in just weeks, people are pain-free and fully functional, and most importantly, have the power to control the muscular deficit, preventing it from reoccurring. So I just want to reinforce that in more than 98% of cases, the cause of pain is muscular. And most importantly, muscular causes do not show up on diagnostic tests such as X-ray or MRI. That is why the vast majority of people, even being treated, remain in chronic pain. Chronic pain is the byproduct of misdiagnosis. Muscular causes are accounting for 98% of cases. These cannot be picked up by diagnostic tests, nor is there any medical specialty educated or trained to identify them. If you find this video to be helpful, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and click on the bell icon to get notifications when new videos are added. If you would like to contact me, you can contact me by email at drmitch@mitchellyass.com. If you would like to make an appointment to be treated through the Yass method, whether in person in Jacksonville, Florida, or by Zoom session, you could do so by going to my website, www.mitchellyass.com. I'm sorry, www.livewithoutpains.com. Boy, I forgot for a moment. www.livewithoutpains.com, and hit the schedule now button. You'll be able to see how the sessions work, what to expect, and when you're ready, you can pick and choose a day and time that works best for you. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.